Welcome to Remy.
Today's subject is the stomach flu. We've all heard of the stomach flu. Questions for today are, what is the stomach flu? How do you prevent the stomach flu? And how do you treat the stomach flu?
Let's get to it. First question, what is the stomach flu? Well, the name is misleading. It's not related to the flu that's in influenza, which is a virus affecting the respiratory system.
The stomach flu and stomach bug are two names describing the same thing. It's an illness infecting the GI tract, not the respiratory tract. It causes both vomiting and diarrhea.
The medical term is gastroenteritis.
Gastro is stomach, entero is intestines.
Itis is inflammation.
Therefore, you have inflammation of both the stomach and the intestines.
An inflamed stomach can cause vomiting, and an inflamed intestines can cause diarrhea.
Therefore, the stomach flu is actually a condition involving both the stomach and the intestine, causing vomiting and diarrhea.
What causes the stomach flu?
Typically, when people say the word stomach flu, they refer to viral gastroenteritis. But gastroenteritis can be caused by multiple things, including bacteria, parasites, chemicals, and medications.
And when gastroenteritis is caused by the transmission via food or drink, it is called food poisoning.
Today we're going to focus on viral causes for gastroenteritis. We're focusing on what's known as the stomach flu. So that's generally what people consider viral gastroenteritis.
There are several types of viruses that are common in viral gastroenteritis, and those are
norovirus is the most common, rotavirus, astrovirus, and adenovirus.
Norovirus causes gastroenteritis in adults typically. For example, those people who are on cruise ships, you see when there's outbreaks typically caused by the norovirus.
It's a cruise ship virus.
Cruise ship virus.
Yeah. It's a cruise ship virus.
Yeah. Just be careful on the cruise ships. The symptom onset of the norovirus is 12 to 24 hours.
Very quick.
Very quick. And the duration of the illness or your symptoms are 1 to 3 days.
Rotavirus most often occurs in children under the age of 2. The symptoms appear 2 days after you get infected and last 3 to 8 days.
Typically around the fall or winter for the rotavirus, whereas norovirus could be all year round.
Anytime.
And then there's the other viruses, adenovirus and astrovirus, which
wraps up the list.
Wraps up the list, but they're not as common as the other one. But there's many other viruses out there, so.
What are the symptoms of the stomach flu, otherwise known as the stomach bug?
Nausea and vomiting.
Non-bloody diarrhea.
Stomach cramps.
Muscle aches.
Low-grade fever.
And general malaise. Just like any viral infection, kind of get the generalized malaise and body aches, headaches. Is it contagious?
It is contagious.
It's contagious. The virus literally travels from the food you're eating or from the object you touch into your mouth and through your GI tract, all the way through and comes out in your feces. It can survive up to 2 weeks. These viruses, unfortunately, get on people's hands. Once it gets on your hands, it can go on the doorknob, the countertop, the chair, glasses, the pen. Next person touches the pen, now has him on his hand. Maybe he has a scratch on his tooth. Maybe he's licking his lips. Maybe he's just eating his food.
Or picking your nose.
It could be from picking your nose. Another reason not to practice rhinotolexis. Then once it gets into his mouth, the process starts all over again, goes through his GI tract, out into his feces, and there we have it again.
Basically, you're eating somebody else's shit.
These poop particles are where viruses live. They just hitch a ride on these poop particles and go from the toilet paper to your hand to the fork to your mouth.
Yummy.
Nobody wants to think about it this way, but literally how it happens.
So that brings us to how to prevent getting
the stomach flu. And the best way to do that is?
Wash your hands.
Wash your hands. And what's the best time to wash your hands? Anytime, before your hands travel from an object to your mouth or an object to another object that can go to someone else's mouth. That's another reason it travels so quickly on cruise ships. You got so many people on one confined area, and what are they doing? They're going in and out of their room, door handle, door handle, door handle. What do you do on cruise ships? Drink and eat. You go to eat, you drink, hands, virus, poop particles go from one to another very, very quickly. You can really appreciate how fast this travels when you're on a cruise ship, and after only a few days, so many people get infected.
How to treat the stomach flu.
AKA stomach bug.
You're going to be vomiting and have a lot of diarrhea. You're going to be losing a lot of fluids, become dehydrated.
Dehydrated.
You want to stop that nausea and vomiting. You may need some medical attention for antiemetics. Hopefully stop that vomiting, and next step, hydration.
Hydration.
Fluids, and plenty of rest.
A lot of fluids.
Yeah.
If you think about it, your body is trying to take care of this problem. You have an invader in your system. You have these viruses replicating, and your body does a pretty good job. It says, let's get rid of this stuff. So it flushes it out that way, diarrhea, tries to get it out this way through vomiting. Trying its best, but it makes you feel pretty bad, but it's doing it for a reason. So you really don't want to stop the diarrhea because your body's trying to get rid of it. You want to get rid of it also. Exception to this is if you're becoming dehydrated.
So you got to be careful of those diarrhea medications. Your body is trying to get rid of this virus, so you might be slowing down the virus from getting out of your system.
If I was a virus, I would probably be supporting anti-diarrhea medication.
I'd be one happy virus.
I'd be one happy virus. Hang out for longer.
Many happy viruses get to hang out with their friends in the GI tract for a longer period of time.
Diarrhea is one of our weapons. Shoot that crap out. Can antibiotics treat viral gastroenteritis?
Not viral gastroenteritis.
Oh, it's a virus.
Yeah, it's a virus.
Antibiotics treat bacteria. There's a whole array of illnesses and conditions that cause diarrhea and vomiting. That's one of the problems with this type of syndrome and illness. It's difficult to really know for sure if it's the stomach flu, viral gastroenteritis, because so many other things can cause it. Therefore, we recommend getting medical treatment for any type of illness that causes dehydration.
If you're not vomiting and you're able to take sips of water to properly hydrate, you just let the virus run its course, you'd probably be okay at home.
Take it slow. First day, some fluids, water, maybe Pedialyte, anything with some electrolytes, and then kind of progress towards solid foods with bread, bananas, rice, apples.
You got to be careful about dairy because you may be temporarily lactose intolerant, may make the diarrhea worse.
Yes, also sugary drinks, alcohol, and sodas may not help in this situation and may make things worse.
Seek medical attention at any point.
Your condition could be life-threatening.
Like dehydration, if you had bloody poop, if you have severe abdominal pain, if you have altered mental status. Remember, there are literally many other causes of vomiting and diarrhea. It's not just gastroenteritis, so seek medical attention.
For any concerns.
For any concerns. Thank you for watching, and remember to like and subscribe.
I think that wraps it up, you know?
That wraps it up.
Yeah.
Wait, how to treat it.
Did you wash your hands?
I did wash my hands, I think.
Oh, good.
I just had diarrhea before, too.
Well, I'll have it soon.
Yeah, it's all right.
Part of the job.